Have you ever wondered why the world works the way it does? Welcome to a journey of endless discovery. This is Explanium.
India has made notable progress in reducing child stunting, expanding immunization coverage, and improving maternal health care across the country. However, data from the National Family Health Survey 6 reveals a persistent barrier. Poor diet quality, maternal time poverty, and the high cost of nutritious food continue to limit national health outcomes. The nature of India's nutrition challenge has shifted. The primary issue is no longer calorie volume, but a crisis of access to balanced diets rich in essential nutrients. This dashboard tracks recent base-level improvements. Child stunting declined to 29.3%, and severe wasting fell to 5.2%. For preventative care, institutional deliveries increased to 90.6%, antenatal care reached 95.9%, and full vaccination rates stand at 82.6%. Government initiatives like the Poshan Tracker, Anganwadi services, targeted millet promotion, and the introduction of biofortified crops have contributed directly to these health gains. Securing this baseline is essential. Nutrition dictates early physical and brain development, which ultimately drives the long-term workforce productivity India needs to capitalize on its demographic dividend. Despite these gains, the current reliance on basic calories has created a dual health burden. The population now faces persistent undernutrition among children, alongside growing obesity among adults. Poor complementary feeding practices restrict early child development. Simultaneously, working mothers face a lack of childcare support, and maternal anemia continues to complicate pregnancy outcomes. For many households, the barrier is economic. Rising food prices force families to stretch their budgets, prioritizing the volume of food over nutritional quality. In adults, the consumption of ultra-processed foods is accelerating rapidly. This dietary shift drives rising rates of lifestyle diseases, including diabetes and hypertension. At the source of the supply chain, agricultural incentives still favor the production of rice and wheat. This limits the widespread cultivation of nutrient-dense crops like pulses, millets, fruits, and vegetables. These demographic patterns indicate that malnutrition is an outcome of broad economic and agricultural structures, rather than isolated individual dietary choices. Healthcare improvements alone cannot solve the crisis. India must transition from calorie security to nutritional security, and from food availability to diet quality. Programs must shift from treatment to prevention, moving away from centralized schemes in favor of localized solutions. Future policies must specifically target dietary diversity and the affordability of nutritious food. This requires expanding maternal support systems, building climate-resilient agriculture, and directly addressing the rise of ultra-processed food consumption. Achieving true nutritional security is a whole-of-society effort. It requires integrating agriculture, health, education, and local governance to ensure every citizen has access to a healthy, diverse, and affordable diet.
Thank you for watching. Subscribe to Explanium today and discover a whole new world of knowledge and understanding.